we want to make sure we give easy access to families and children in the Inland Empire.
This is us making it easier for the families. Let us do all the work. You come sit across from us and we'll help you through your problem.
We hinted towards the CYBHI program. And the CYBHI program is the California Youth Behavioral Initiative, right? And this initiative, we created into a program within our own organization that we want to make sure we give easy access to families and children in the Inland Empire and really across Southern California if it's done via telehealth. And this program was developed, we started in 2023 with just as simple as a conversation. It was me sitting down with City Councilwoman Kimberly Calvin. And, I'm asking all the questions. Hey, if we want to be successful and help people, what is it, that most of our families need help with? And she just said, right now we see you guys do behavioral health services, but do you guys offer more, right? And I started looking at the families that we serve and thinking like, okay, in one situation, a family was maybe struggling with drug abuse, right? And that's something we can help with. So we constantly are trying to find someone really quick to call around and get these resources. Someone else is, fathers having mental health problems that's affecting the child when it comes to their ABA service program, even down to homelessness. We went above and beyond, all the way down to providing food, meals, and talking to her, she made it clear that there are other resources out here. They're hard to get and they're hard to obtain, but there's other resources out here that you guys can gain access to ensure that you can look at the whole family. Because I was very clear when we started the company that we wanted to encompass all of the family needs, whether we partner with someone to get those needs out to the family or whether we develop them ourselves. So that's how the CYBHI program was originally. And it was funded because we were able to go to the state of California and apply for a grant, which was a long shot because, typically most of the school districts and bigger organizations were getting these grant funds, but we were lucky enough to be awarded a grant to provide this service. So everyone can have an idea, but until that idea is funded, it's kind of hard to actually provide it. So, we had meetings and we came up with the idea that opposed to us just trying to develop the services, we can do a lot more if we partner with people who are already the specialists. So that's how we came in contact with Escape Therapy and other companies to help expand our reach when it comes to this program. So, as of now, Yamile, you as the program manager, can you give us a little insight on the program and where is the program at today? How long is the program going to last for? And what are we doing day to day to make sure families are gaining easy access to services?
That was a lot of questions, but I'll try to remember them. So the CYBHI program, our goal and what we've really been pushing for is ensuring that when there's a family in need, right, outside of ABA services, right, when there's a family in need, that we're able to offer mental health services, right? So that's our goal is to provide 5 free therapy sessions, right? And that's kind of like a buffer for all the stuff that we usually tend to experience when we're trying to get therapy. There's a wait list. You have to wait for someone to reach out. There's this process, right? So our goal is to Dr. Green said earlier is to kind of create that pathway so there could be permanent services with that provider that they are paired with, right? And then in addition to that, aside from the therapy, we have our big backpack drive that is coming up. And then we're also supporting with, ABA services here and there as needed. The state of the program, I think we are, we're growing, we're, developing. We still have a whole nother year left with the grant. So that's really exciting. We were able to get, an extension for the program. How they can get services is they can go to our website, 360humanservices.com, and fill out the interest form. When that form is filled out, we go ahead and we reach out via phone to confirm the services that they're seeking. And then from there, we start working to pair with a provider that is available.
And one of the biggest things that I like to take away from this program is that because we're working with different practices, it makes it so that there's no waiting list.
Yes.
Because our goal is easy. make it easy, so any type of situation to where someone feels like, maybe I don't have medical insurance, we don't require it. Maybe I am not a citizen, we do not require that. Maybe I'm not sure exactly what service we need. So with that being said, is when you fill out that interest form, the next step that happens is we look at what basically what you're requesting, what you need, and then we will find a provider within our, we'll just say in our group. And all of our providers are licensed clinicians who typically have a lot of experience, and we have different providers or different practices who focus on different types of therapy. So the next step that will happen is if you'll be paired with, let's say, True Escape Therapy, we'll reach out to True Escape Therapy, and then what happens next?
Now, we receive the email from Yumule, it goes to our admin team. We have a scheduler, a biller, and an office assistant. They actually reach out to the family to get them scheduled. Once they're able to get the family scheduled, we then reach back to Yamile to let them know and confirm that they received their first scheduled appointment. If we're unable to get a hold of them, it's still by the end of the day, our team reaches back out to Yamile to let her know either the contact information didn't work or the person didn't call us back. That's just to keep the communication flowing between us all so that we make sure that this individual gets the services that they desire. After we schedule them and we see them, we connect on a monthly basis. So she knows how many sessions we've had with them for that month. She knows if they're continuing their sessions. She knows if they're finishing their sessions. She also knows if they're extending their session.
One of the biggest takeaways from this entire program is you have people ensuring that you can gain access to therapy services for free. And the goal is not for you just to do the 5 sessions. The goal is from the time they're with Dr. Green is for, if you need more than 5, is that she's going to bring you into her practice and continue ongoing therapy based on your medical insurance status or, what your actual need is. So this is a one of a kind program. I will say there's not many programs that I know of that exist this way. And it's all meant to help the community. So, one of the biggest things is if you need the service, just go on 360humanservice.com and scroll down to the interest link and just put your information in. One of us will reach out to you, whether you feel comfortable on a phone call, text message, email. We try to meet you where you're at to ensure there's no barriers. So we're lifting all the barriers to ensure that you get quality care from a licensed clinician. My question would be is, Dr. Green, is how do you feel the program is going in helping you and your organization also reach your goals?
I think it's helping us reach our goals by allowing me to continue to offer a holistic view, a holistic approach. So it's a one-stop shop. When someone comes here, they don't have to worry about, okay, now I have to go and look for this. No, we have access to it. They have a referral for us. We have a referral for them. You know what I mean? So we're going to help them along the way. One of the things that I love about my practice is we don't just have clinicians, we have a whole admin team. So the business office behind the scenes is going to help and make sure that that client doesn't have to do much groundwork. They're going to do all the work for you, to include contacting your insurance. And all you have to do is show up for therapy, right? You said earlier, Harry, that you want to make it easier for the families. This is us making it easier for the families. Let us do all the work. You come sit across from us and we'll help you through your problems.
And then for you, Millie, what impact do you think the CYBHI program and its whole approach, whether it's the ABA GAP program, where if you don't have insurance, we can give you a limited amount of ABA services, whether it's the 5 free sessions of therapy that we offer in the CYBHI program with a licensed clinician, whether it's the workshops that we put on, and whether it's even the community events like the backpack drives. What do you think this is going to have as far as impact for future generations?
I think it kind of creates something that a lot of us as clinicians have a vision of, right? Like we're like, oh my gosh, we want to be able to do everything just come together, right? I think this is kind of like an opportunity to be able to see, the intention of let's kind of, work through, maybe some like wraparound services, right? Where it's including behavioral health, mental health, workshops, like community, resources, where it's putting all of this stuff together into one program. I think it creates, an opportunity for vision for the future, for opportunity for the future, and it also provides access outside of areas that maybe some of our families don't have access to.
Dr. Green, your commitment to families and it extends beyond therapy, obviously, based on all the different things you're doing, which I find amazing, right?
Thank you.
True Escape has also supported community members through food outreach and other community programs. I really, really want to hone in even deeper on like how does this program kind of fall into that vision, and what is your inspiration, and do you have plans to do different types of outreach?
Yes. I actually made an agreement with my husband, though. We don't talk about it until
Okay.
it's actually done. But what it allowed us to do with the IG program, the intergenerational program, the Truition program, even being collaborating and partnering with 360 Human Services, all of it has pushed us out to the community to build trust. So the community knows when they see my logo, when they see True Escape, something's about to happen. Something's about to change. We were able to expand into Lancaster. So now we're focusing on LA County. So now for the High Desert and San Bernardino County, they see our logo, which is now trademarked. Yay!
Congratulations.
They see our logo and they can trust that whatever services we're going to bring, we're going to have that holistic view to where they have access to resources and they have support in whatever they need.
We'll switch gears a little bit and talk about the backpack drive. Yamile, can you give us information on the backpack drive and what is the vision behind the backpack drive? And if someone wants to get involved, how would they get involved?
Yes. So our backpack drive is going to be taking place August 1st at the Fontana Senior Center. It'll be from 10 a.m. to 2 p.m. And our goal with the backpack drive is to provide 1,000 backpacks to children. In addition to the backpack drive, our goal is to also pre-backpack drive do a little kind of like resource fair, right? Where we have different, vendors coming out. So, for example, IHP, Inland Regional Center, they will be attending, providing resources, providing support, right? So that is kind of what our goal is for the backpack drive, which we are, so close. It's happening very soon here. And then if anybody would like to participate, be a vendor, sponsor, they can also go to our 360 Human Services website and they can, let us know through there that they're interested. They can also reach out via Instagram, email.
Do you have any major organizations, businesses partner with you to do the backpack drive?
Yes, so we have Chase Bank that will be there. They will be providing workshops, finance literacy workshops. In addition to Chase, we will have IHP. They're going to be coming out as a vendor, but also to support with evaluations for children under the age of 5. And those reports will be provided to the parents right then and there. They will also be supporting with, referrals and services needed. At that point in time, IHP will support with directing them to where they need to be going depending on the service that they need. We will also be having the regional center there, the Inland Regional Center there as well. And then we do have planned for other vendors to be out there as well.
It's all about giving, right? Backpacks, resources, early assessments. That's huge, right? Because once again, at the end of all this, we want to make sure that families have access to the services earlier than later. Because we want to find it. We hope that they find us. We don't find them, right? Two options, right? So this backpack drive is going to be a huge hit for the Inland Empire. You don't have to live in a city or city of Fontana to be a part of it. You can come from anywhere in the Inland Empire to be a part of the backpack drive. We've recently had the Mayor of Fontana endorse the backpack drive. She'll be there with her team. We also have other government officials who are signing on to make sure they get the word out and they offer resources when they come out. And it's all about bringing mental health, behavioral health, and financial literacy all together, because if your finances ain't right, your mental
Nothing is right.
nothing is right. So you want to make sure it's free of charge, and it's so important that if you are in or near Fontana August 1st that you come out. If you think you can help us and you would like to be a vendor, you have resources to give for free. No one can sell anything at this event. It all has to be given to the public. Please reach out to us on our website, 360humanservices.com. We do have a interest form under the events tab, and you can find more information on the website on how to contact us if you're interested in being a part of the Backpack Drive. Dr. Green, why are events like the Backpack Drive to you?
Because it's telling the community we're helping you. They
Yes.
trust that you're going to support them.
Yes.
So that's why I think it's awesome. And I like what you guys are doing. That's more than just a backpack drive. She was saying it, you were saying, I'm like, whoa, financial literacy, that's awesome.
Yes, we're trying to make sure we get the most out of that space. Okay, but no, really, you know, we only can do so many events and it's just so many different ideas. So we had to just narrow down to like 4 things we can possibly do at that event, which most people will still say that's a lot, but there's so much more that's needed, man. And it's just like, as a child, I relied on these type of things, to get my backpack. I relied on programs like yours for us to get food. They used to come in a box and it was not edible. I see the food you're giving out. I'm like, oh my Lord.
A whole grocery list.
Man, I wish you know.
But I like the financial literacy because not only you've heard of the saying, like you give a man a fish, right? And he'll eat for a day. You teach a man to fish and he'll eat for a lifetime. What you guys are saying is, hey, we're going to give you these free resources, but we're also going to teach you how to manage your money and your funds so you don't have to continue to rely on free resources. You can get free resources. It doesn't mean that you're poor or broke, but you want to have the option, right? I'm not desperate and in need of it because my kid's not going to go to school without it. Like, no, here, I can go and then now I can participate. Now I can become a vendor, you know what I mean? Because I have the financial literacy to do so. So
thank you. And once again, Chase Bank are the specialists and
wow,
they have all the money. They're coming out to actually say, hey, we want to help the community. I really have a great admiration for Chase Bank and their attempt to make sure they get involved in underserved communities, right? They don't have to. They're doing it because they want to. So
nice.
Always give kudos to them. And I love the fact that they're happy to come partner with us and come out and teach that. So,
but kudos to you guys
Yes.
too for reaching out to them to even do that. Because now what you're doing is you're demanding that support, right? Not saying like, hey, if you don't, do this, but you're saying, hey, let's give back to the community, and you're allowing them to do that. So kudos to you guys too.
Thank you.